In our instance, workflow remains king of the hill. We have found that clinicians and other users, including public health professionals, care a lot about workflow and efficiency and how this NHIN thing is going to fit into their daily routine in providing care and monitoring the population's health. And so at a local level, we spend a lot of time thinking through how the NHIN really kind of pieces things together at a national or regional level. And then on the back end of that, we really do have to think about how the NHIN integrates with existing electronic health record systems and other health IT applications that we have in production, because we're not sure, we're not convinced anyway, that physicians are willing to necessarily sit in front of a terminal and click a button to execute queries across this broad network. So what we're looking to do is we're looking to find ways to take the specifications and the technology and integrate it in such a way that it automates a lot of that in the background, but supports the end user's information needs. And finally, we've found that you need to define health indicators and syndromes in a computable format. That's challenging, but we have a draft specification that Charlie mentioned, and we're putting that into production, and we'll learn lessons from that and feed that into the standards development cycle. And developing specifications and standards requires a lot of input, patience, and we're moving towards adoption and time to refine those. Thank you.
Okay. Well, Brian and Chuck, thank you very much for the very interesting presentation. Tom Fritz, who's a member of our board, I know you're also involved in this project from the Washington State side of things. So thank you. Now with that, Liesa, Liesa Jenkins, CareSpark, Executive Director, thank you for joining us.
Thank you, Simon. And I'll try to go quickly so we do leave time for questions at the end. I really come from the perspective more of a group of very small organizations compared to those of you who have spoken beforehand. In our region, we don't have any large organizations other than the VA and the federal agencies, frankly. We've had to bring a lot of small people together to accomplish what we want to do in our region. And I think when I speak to our interest in participation in the NHIN, it comes from a recognition that all of us need to get there together, that it's not enough for the larger organizations and the larger communities where there are lots of resources to succeed, but that many of us in small communities and small organizations also have to arrive at the same time. So speaking from my community, we're straddle state lines. We have patients that come together from 5 different states to receive care in our community. We're about 750,000 people. And unfortunately, we are the poster child, almost the perfect storm, if you will, of poor health outcomes. Just almost anything you look at, chronic diseases, premature mortality, death from prescription drug overdose, unfortunately, that describes our community. And a lot of that we feel is caused because of the fragmentation of the siloed systems and organizational barriers that are there that prevent patients from receiving the care they need in a coordinated way, that prevent clinicians and providers from working together for the good of their patients as they desire to do. So, with that said, our organization, which started working in 2004, immediately recognized that we could not just work in our own little community, our own region, but that we needed to be plugged into the other things going on, that we couldn't accomplish what we wanted to do by ourselves in our region, that we needed to pair up and follow along with and align with the things going on in our respective states and at the national and even international level in both the public and the private sectors. So we've tried very, very hard to stay aligned with all the things going on. But our original goals, established in 2004 through a very comprehensive planning process, really kind of mirror very closely what ONC and other organizations have focused on, making sure that patient information and guidelines about what should be decided are available to the people making the decisions, both the providers and the patients at the point of care. and using that information to monitor population health and see what the opportunities are for improving public health and patient safety as a whole. Looking at ways to engage the patients and their families in their support networks to make sure that they have the information they need and that they can be an active participant in managing and making decisions about the healthcare. And then finally, looking at the cost outcomes and making sure that the investment of resources, wherever those resources come from, public, private, nonprofit, state, federal, personal, that it is a win-win situation as much as possible. So going to the next thing, we've had a very strong focus and a lot of leadership from very dedicated folks in our region, from the business sector, from the healthcare sector, and people who really have a commitment to quality improvement. And that has guided us since the beginning at being focused on looking at measurable outcomes and process improvement, not just technology for technology's sake. So we really see the Nationwide Health Information Network and the Health Information Exchange that we've built in our region to be the means to the end, which is really improving outcomes. We've grown. I'm proud to say that although it's been slower than I ever thought it would be, we did become operational in fall of 2008. And in our first year, we had about 175,000 patients in the region who agreed to participate and have their information exchanged through the system. We had 5 organizations that initially were able to connect and contribute information through the network and exchange with each other. But we're seeing pretty rapid growth in that as other organizations adopt and implement their own electronic systems and have the ability to contribute electronic information. We're seeing expansion outside of the original Tri-Cities region from neighboring communities who want to use the infrastructure that we've built and take advantage of those resources. We're exchanging, frankly, whatever kind of information those systems are ready to contribute. Some of that is because of their electronic capabilities. Some of it's because that's what their staff are ready to do, or their lawyers will let them contribute. But whatever they're able to participate with, then we have found a way to exceed both standard and non-standard systems. We do have a little translator in the middle of our HIE that can take almost any kind of electronic data and populate a CCD so that it can be consumed in a standard way. And then we do expect to see pretty rapid growth going through this next year as providers are looking to move into use of electronic systems in order to achieve meaningful use and get those incentives which are so important to their bottom line. So I'm proud to say that CareSpark is and will continue to be very committed to participation at the state and national level. We began with the earliest planning for the Nationwide Health Information Network in 2006, and we continue also to be very interested in working collectively with others in our central Appalachian area where the health outcomes, we have kind of unique characteristics, as you will, similar challenges and similar demographics. So that is very important to us to work with our neighboring communities and to try to see what we can do to stop being kind of one of the dark spots on the map when you're looking at health status. We have and will continue to participate with the Nationwide Health Information Network. Currently, we're in the process of educating our local participating organizations about the requirements in the Data Use Reciprocal Services Agreement, the Data Sharing Agreement, so that we can adjust the ones that they originally signed to participate with CareSpark to enable them to participate and to know what the expectations are as we move into exchange through the Nationwide Health Information Network. We are one of the organizations that just recently committed to work with Social Security Administration, but we continue to see huge need to participate with the VA. In our region, 11% of our citizens are veterans. We don't have an active military base, but we have a lot of veterans.
So they provide a lot of care for folks in our region. It's very important to us in our local healthcare environment to participate with them. In our hospital systems, 70% of the care is covered through the Medicare or Medicaid. So CMS is a huge partner in our healthcare ecosystem. And as I've mentioned, we very much want to participate with those communities that lie adjacent to us. North Carolina, West Virginia, Kentucky. We're looking, we've been working, we've been talking, and we're very interested in exchanging, not just with federal agencies, but with those other health information exchanges to enable care coordination for people who travel across those state lines. So we're currently in conversation with Med Virginia in Richmond, Virginia, and with New York about testing of medication management exchange, because again, to tackle the problems we have from people who are dying because they go across state lines and get prescriptions for things that interact in a bad way. People die in our region from that, and we are absolutely committed to changing that and using whatever resources are available us to do that, including the Nationwide Health Information Network. So the last thing I would say is, I know that Dr. Fritzman spoke about state-level HIE and the resources that are going there. I just want to provide a gentle reminder that those state lines don't necessarily always capture the way in which information needs to flow. So we do want to make sure that there is alignment, not just with the state-level HIE and the nationwide efforts, but also with the regions that don't necessarily fit state lines. What have we learned? I think I've covered most of this, but I would encourage all of the communities that are looking at how you can use health information to improve health for your citizens to look at the possibilities that come when we are sharing what we learn about the advantages and disadvantages, the challenges of technologies, the challenges of overcoming the legal barriers that are there, the business and financial problems that must be addressed. But together we have to get there. As a country, we can't afford to stay where we are nationally on health. We certainly can't in our region, and we're committed to doing everything we can.
Liesa, thank you very much. I really just want to thank the panel for, I think, what's been an exciting presentation. Join me in giving a round of applause. Yeah. Now, I want to apologize to the board. I realize I'm sure you have many questions. This is really meant to be sort of the whole day, an experience of really getting into the issues and the opportunities related to the NHIN. I mean, we will have future sessions, I think, be able to, in a more leisurely fashion, have some of the presenters come back and talk through the issues and the opportunities. But recognizing we're running a little late, I want to turn this back over to Laura for the final aspects of this open session. So again, thank you so much. It's been a great set of presentations.
I'd like to echo my thanks and thanks Simon also for putting together such an informative, and I don't know about you, but I feel quite inspired. The challenges ahead of us are always great, but when you hear stories like that and you realize the effect of our work and how important it is on the level as Liesa described, it's just incredibly energizing, I think. We'd like to now move into the public comment period and next step period. So unless anyone on the board has anything else to add, I'm going to open it up now to the floor for comments from the public. If you've joined us in person today and you'd like to make a comment, there's a microphone in the center of the room. If you could approach the microphone to make a comment, please. If you're participating electronically and you'd like to make a verbal comment, you have to be logged into our webinar and have used the webinar-generated attendee ID that you used when you signed on over the phone. You can also send in an electronic one by clicking the raising the hand button that appears just under the list of today's online participants, or once again, you can send us a comment online and we will read it